and symptoms of poor mental health are extremely common in a mediation setting. This is largely because conflict and mental health have a cause and effect relationship. If a party has a diagnosable mental health condition or often finds themselves struggling with their mental well-being, they may find themselves in conflict situations more frequently than those who are doing well mentally. The stress that arises from being in a conflict situation can lead to a decline in mental health, even in those who were previously mentally well. Add to that the stress of engaging in a mediation process, and the emotional burden can become overwhelming, making it essential for us mediators to approach these situations with sensitivity and care. So let's briefly talk about some of the signs that we might see that show that somebody might be struggling with their mental health. You might notice things like increased anxiety or agitation, difficulty concentrating, or emotional outbursts such as anger or continuous crying. Parties may become increasingly restless. They may look away more or demonstrate with their body language that they're withdrawing, either by completely leaving the process in the room or just by hiding themselves away and sinking into themselves, closing themselves off. It's not our job to diagnose, but it is our responsibility to create a safe space for everyone involved. But how do you bring it up without making anyone uncomfortable? Some of this comes from your preparation. When I first speak to parties, I will ask whether they have any mental health concerns they will need support with, whether diagnosed or not. If they have shared this with you, discuss reasonable adjustments that allow them to engage meaningfully in the process. A couple of examples of these may include more frequent breaks, having the mediation online rather than in person, changes to meeting timings, and use of visual aids. Also consider exploring how much other parties in the mediation know about any concerns and the ground rules for discussing them within any joint sessions. Having the conversation in advance makes it easier for you and the party to discuss any symptoms that may come to the forefront during any of the sessions. If they haven't shared with you any mental health concerns, either because they don't feel comfortable or may not even be aware of any at this point, still be alert to any changes in behaviour or engagement. It is more awkward to have a conversation if you don't know in advance, but it isn't impossible. Any changes should be approached with curiosity and non-judgment. Keep it neutral and focus on what you observe. For example, you may say something like, "I've noticed this conversation seems really challenging for you. I want to make sure we're all feeling supported. How are you feeling about continuing today?" Remember, your tone should be calm is contagious, and remain empathetic. This opens the door for them to share if they are comfortable, but also gives them the chance to decline to share further. If mental health becomes a concern, gently signpost them to professional support. This isn't about pushing them into something they are not ready for, but offering resources and empowering them to take the next step. Normalize and validate by saying, sometimes these situations can be overwhelming, and it can help to talk to someone trained to support you. If you think that might be helpful, I can provide some resources. The CMC and I have put together a list of resources as a starting point, but take time to understand what else is available or what they may already be accessing. And remember, your role as a mediator is to facilitate a safe, productive conversation. Addressing mental health with care and empathy is a big part of that. By recognizing the signs, staying compassionate and observant, approaching with sensitivity, and signposting to support, you're making mediation more supportive for everyone. The information contained in these videos is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for information and educational purposes only.